That is my favorite version of Baby Shark. It absolutely is. My kids are bigger now, and Baby Shark is not a thing anymore. But search for the R&B version of Baby Shark. It will make it more bearable for you. You're welcome. Follow me for more parenting tips. Hi, guys. It's Dr. Adams. Welcome to the Full Circle Women's Care Practice and Pregnancy Orientation. Some of you I saw a little bit earlier today. We did your history visit. Some I saw yesterday. Some I'll see tomorrow, and some will be here on Thursday. And I think I did some of you last week as well too. So thank you for remembering, because pregnancy brain is real. Thank you for remembering to join me today on the Zoom. We have a lot of topics to get through. I believe you guys can hear me because I saw some hearts going up, but go ahead and raise your hand and just let me know your electronic hand and let me know that you're out there. Okay. All right. I see the hands going up. No, I see some people that I'm going to see a little later on this week. Cool. Good to know you're on the call. All right. So, things we are going to cover. Have some housekeeping items first. First of all, this is confidential. So you can ask questions and no one will know that it's you. And I will answer the questions in such a way that no one knows that it's you. But if I think the question is too personal and someone may be able to figure out that it's you, then I may say, hey, hold that question until your visit or talk to your provider in upcoming chat. Please participate. Ask me questions. This is live. I'm real. And so you have my undivided attention. And I want you to participate. I have some poll questions throughout to make sure that you're catching what I'm putting down and staying awake as well. And if you have to jump off, I know it's getting close to dinner time. Just know that this will be recorded and available on our YouTube channel afterward. You will receive a link from Zoom. I think it comes out about 24 to 36 hours after the call, and you'll be able to watch this all over again. Let's start with a poll question. So this is a great example of how our poll questions go. Who is on the line? How many first-time moms do I have, and how many veteran moms do I have? And I will kind of say some words for a little bit. I'll do better than that next time. And then I'll say 3, 2, 1, polls are closed, and we'll close the polls and we'll have the answers there. And I have more mommy veterans than first time moms on the line this time, but that's okay. This is a good review for mommy veterans. Because pregnancy is kind of a blur. You're like, I know I did some labs and some ultrasounds sometime, but I can't remember when. I'm going to go over today exactly when what happens at what week. And first time moms, sit close because I have a lot of good information for you. Probably going to answer most of the questions in that little notebook I know you have sitting right in front of you. So today we're going to go over the full circle experience, which includes where we deliver, some office protocols, what to expect at your pregnancy visits. I'm going to give you lots of prenatal resources. We're going to go over exercise and nutrition in pregnancy and finish up with a quick COVID-19 update. All right, so first, our philosophy. Full Circle Women's Care is based on the collaborative midwifery model, which begins under the auspice that pregnancy and birth are normal life processes. This is not a disease that you contracted of which we must cure you. This is something normal. Based on the midwifery model, the traditional midwifery model cares for normal, low-risk women, and if an abnormality is identified, then they may have to transfer out of care of the midwives to a different level of care or different practice or service. In the collaborative model, you're able to stay under the care of the midwife with physician direction. So if you develop some issue with the pregnancy, you don't have to leave the midwives because 9 times out of 10, you're still going to deliver in the way that midwives can deliver you. But we can still direct what the issue is with the pregnancy through the physicians. To that end, the majority of our deliveries are attended by the certified nurse midwives. So I know many of you came in as my GYN patient, Dr. Marrow, Dr. Mooney's GYN patients. You're like, wait a minute, I thought I was just going to switch over and then just have you guys deliver my baby. Midwifery model. So if you are normal and you are low risk, then the expert at delivering vaginally normal low risk women are certified nurse midwives. If there is something that's outside of the scope of a normal delivery, so even a person with a pregnancy complication can still have a normal delivery. So if something occurs and say you need an operative delivery or an operative vaginal delivery, emergency physician consults are definitely called. And there's urgent and there's emergent. So urgent is something that can't wait until the morning, but it can wait 15 minutes. Dr. Mara, Dr. Mooney, and I all live within that radius of the hospital, and we are called out to back up the midwives. So, for example, if we have a baby who's misbehaving, maybe needs a rotation or vacuum or something like that, then they call us, we come in and we do that. If there is a true emergency, then our hospital of delivery has OB hospitalists who are board certified OBGYNs, and they are there to be able to get your baby out in less than 5 minutes. To put that in perspective, true emergencies. We did over 540 deliveries in 2022, and only two of them did they even call the hospitalist to start the delivery. And Dr. Marrow or Mooney or I were there by the time the baby was being born. Um, so that is why we want you to meet everybody there because we don't know who's going to be at your delivery unless it is something that is planned. And most of our patients come to us because they want things to be as spontaneous and natural as possible. It could be whoever the midwife of the day is on call, or the physician of the day who is backing her up. So where do we deliver? We are now at HCA Florida Hospital, formerly known as Memorial, which is on University Boulevard, less than 10 minutes from our office. They are doing tours. They're doing one-on-one tours. So at your visit, ask your midwife for the phone number, and she'll give you the Director of Women's Services office, and they will find a time that is convenient for you. They do tours during the day. They do them in the evenings. They do them on the weekends. They make sure that they accommodate your schedule so that you can see the facility and know exactly where you're going to meet your little one or little ones. HCA also offers classes. So there's childbirth education classes, there are breastfeeding classes, and these adorable sibling classes. So veteran moms, this is a thing. Kids who are 3 to 7 and older, preparing them to be big brothers, big sisters, big helpers, and excited about the baby and not doing the Elmira, love him and hug him and squeeze him until there's a catastrophe. There's also more community help for childbirth education classes and breastfeeding classes, which we'll talk about a little bit later on. But you can also just reach out to HCA, the Director of Women's Services offices, and they can tell you when these classes are starting so you can get into the rotation to have your childbirth education classes. Our office is open Monday through Thursday from 9 to 1. We close for lunch from 1 to 2. And then we open back up from 2 to 5 for our afternoon session. So if you call us between 1 and 2 on Monday through Thursday, you will get the after hours line. There's the reason that we have an after hours line is because that rings to our emergency provider on call in case you have an emergency between 1 and 2. If it is something that is not emergent, please do not leave a voicemail for the person who is on call because she's not going to cancel your appointment or know that you're going to be 10 minutes late. She's in the hospital. Please call back after 2 o'clock for administrative issues. If it is an emergency, please leave a voicemail for her to call you back immediately. On Friday, we're open from 9 to 1. So if you're calling with something non-emergent at 12:53 on a Friday, please know that it may be responded to on our next day of business. First question I have, how soon or how late do you recommend taking classes and taking the HCA tour? So the childbirth education classes can anytime after 20 weeks is very reasonable. And the tour I'll actually be referencing in one of the documents coming up. Good question. Appointments. We are not doing walk-in appointments. Our goal is to see you as close to your appointment time as possible. And if we promised you the 3 o'clock spot and somebody else walks in at 2:58 and says, I need to be seen right now, that is disrespectful to you. We are not going to give away your appointment time to that end. We have some limited same day appointments. So sometimes people deliver. Appointments fall off. People forget they had an appointment and they call to change it. So if you call us first thing in the morning, 9 a.m., hey, I need to be seen today for this. We may say, hey, you know what? We have an opening later on at 2 p.m. today. Why don't we put you on the schedule for that? If you are unable to wait for that 2 p.m. appointment, then that is an urgent matter. And what we might say is, then we think you need to go to an urgent care or to labor and delivery to be seen. That is not us saying that we don't want to see you. That is us saying that we agree with you. This is an urgent matter. It should not wait until 2 o'clock. Please go someplace where we can see you on a more urgent basis. Question I have. Okay, this first question I have here is about nutrition, and I'm going to tell you all about Publix deli subs when I get to nutrition in just a moment. So hang on to that question. When you call the office during the day, we are not able to leave patient appointments to take phone calls because, again, if I promised you your appointment time, I'm not going to leave your appointment to go talk to somebody else. That's rude. And so please just show our patients who are here seeing the providers the same respect. If you do call, please leave a message in order to receive a call back, and please be sure you leave a message with the right person so that we can answer your problem efficiently. We had a business meeting today about directing calls, and so we are ready to get back to you in a timely fashion. Where do I leave my message? Great question. If you have a question about administrative things like letters or forms, FMLA paperwork, disability papers, Tony is our nurse. Tony also does triage phone calls. So if you're calling and saying, I'm not sure if I'm feeling the baby move the right way. I'm having some spotting. I think I have a urinary tract infection, that sort of thing, like clinical matters. Tony has a scope of things that she addresses. If it's something outside of her scope, she knows how to get in touch with the provider on call to ask a question for it. The OB clinical coordinator, many of you have already heard from her because she's the one who sent you those cute little confirmation pictures of your baby. She will also be the one who sends you the email with your OB labs. And for those of you who have already done your history visit, look for them in your spam box if you have not seen them by close of business the following day. So she will send them out. Usually I talk to you, say on a Tuesday, by 5 p.m. Wednesday, you have your lab orders to take to Quest. She's also the one that if you need to have something scheduled, like a cesarean or your induction or a version or a referral to high-risk doctors, she will be the one your provider tells her, and she coordinates it and communicates with you over the patient portal. All right, the question I have here is, how are planned C-sections handled? Just answered that. All right. And so we'll also talk about when we'll schedule them and that sort of thing. Administrative concerns, everyone who's had their confirmation should have also already met with Renee Hall. So she's the one who checked your benefits and told you if you need a prepayment plan. If your insurance is changing January 1st, please, please, please be sure that we know so that we can recheck and see if we are collecting on a prepayment plan that no longer applies, or if your new benefits require some other different method of collection. All right. After hours, there is always someone from our practice on call. Now, the after hours line is for emergencies. So this is, I may need to go to the hospital. Please know you must leave a voicemail for the phone to even register that a call came through. If you do not leave a voicemail, we will not know that you called. So I know sometimes people have a habit of calling and hanging up and calling and hanging up and calling and hanging up. We will not know that any of those calls happened unless a voicemail is left. And you'll hear on the voicemail, if you don't get a call back in 20 minutes, please call again. If you don't get a call back and you don't have 20 minutes to wait, y'all, please don't have your baby at home on the bathroom floor because we didn't call back. The person you're calling is the person who is in the hospital also taking care of mamas who may be delivering or having other obstetric situations. So if she doesn't call you back, it's because she's already there, probably doing something else. So feel free to go on into the hospital where you can be evaluated. The question that I have here is, do I need to call to schedule my history with you? I was told they will call me, but I haven't been contacted yet. I do know that the January schedule just opened up, and so they are contacting people who are on the wait list for January histories. If you've already had a confirmation, though, we should have had a history scheduled. So please do send an appointment request to the front desk to make sure that they do get you into the schedule. Thank you for that question. Patient portal. Oh my gosh, I was just talking about the patient portal. So response times can take up to 2 business days. 2 business days. So if you send a message on a Thursday, Friday is 1 business day, the next business day is Monday. So if it cannot wait from Thursday to Monday, then maybe it is not a portal message situation. Remember, portal messages are for things that are not emergent. Sorry, I have a delay over here. So if you guys are seeing the next thing already, non-action items will be answered at your next appointment. So if you're sending a message about something that we really don't need to act on, then we may just pass it to the person who's going to see you for your next appointment, especially if you're going to be seeing that person in the next couple of days. I have had people send me messages on a Thursday and I see that they have appointment coming up on Tuesday, and getting the answer on Monday would not make a difference to their care. And so I'll pass it to the person who's going to physically see them and be able to answer questions in real time. Because a lot of questions, the answer provides more questions, and we're going back and forth when you could just talk to someone in person at the next scheduled appointment. So think things like, I lost my lab slip. I can answer that and respond to that, send you a lab slip, and that's a closed loop of communication. Or have COVID, so I need to cancel my appointment. As long as that appointment is more than 2 business days away, that gives us plenty of time to convert your appointment to virtual so that we can still check on you, make sure that you're okay, and then reschedule your in-person visit. The next question is, sorry, I wasn't more specific. Who will do a planned C-section, the hospitalist or the OB that I'm seeing? So we'll schedule you with someone who works here. That's the whole point of you coming to see us, so that you get to know us and know who's going to be delivering your baby. Please do not send urgent matters over the patient portal. So please don't send messages like, my blood pressure is very high. I'm not feeling my baby move. I'm bleeding excessively. Those are not things. Those are not things that should go over the portal, because they cannot wait 2 business days. Those are urgent matters, and those should be phone calls to the emergency on-call provider. Those are literally the things that we're looking for with those persons. Please do not send blitz messages. One, it's portal abuse. Blitz messaging is when you send a message to one provider. So you say, hey, Lauren, I think I might have a UTI. Lauren doesn't answer you. So 2 hours later, hey, Jane, I think I might have a UTI. Jane doesn't answer. So 2 hours later, Dawn, I think I might have a UTI. Please don't do that. You will have 3 prescriptions at the pharmacy. The pharmacy will be asking us why we're overloading you with all these different prescriptions, and it's not an effective use of our time. And you'll be writing back saying, well, which one of these am I supposed to take? So multiple messages to one provider and or messages to different providers. The computer will also sometimes, I did have it one time, believe that the patient was a bot trying to spam us and delete her entire portal account. We spent the next 6 months trying to get it reinstated. So one message, if the answer cannot wait 2 business days, then it may be a phone call to the office. And then also, please don't attempt to have a whole appointment over the patient portal. If you have questions that may spark a back and forth discussion, text them to yourself to bring them to your visits, or schedule an appointment. We're happy to have a conversation with you in person. The portal is really for things that cannot wait until your next visit. We see patients for 8 hours in the office, and then we do our charting for a couple more hours. We want to spend a few hours with our families, but we want to still be able to give you good service. So the portal is something we do in our personal off time, actually, to try to improve your care. So we really would just appreciate not being abused on the portal with multiple things that could wait until the next day. The next question I have here is, who's the main person we should portal message? The last person we saw in office. I usually default message you. So I know who you are, and you'll probably end up messaging me. But really, if it's something that's kind of a continuation of a conversation that you just started in the last visit, yes, please message the person who you just saw in office. That's a great question. All right. Other ways that we use the patient portal are to release your ultrasounds. So if there is something urgently abnormal found on your ultrasound, we will not let you leave the building without having a discussion about it and making a plan for it. If you don't have an appointment with someone to discuss it on the same day, then the ultrasound report has to download from the ultrasound machine, upload to our medical record system, be distributed to providers, and received and reviewed and released to you. So give us 2 business days. There's a theme here. Give us 2 business days to receive them, review them, and release them to you on the portal. If you know that your anxiety will not allow you to wait 2 business days, please be sure that you make an appointment to see a provider after your ultrasound is scheduled on that same day. Typically, the ultrasounds, like I said, take a little while, but we can print out the report on that day and give it to a provider who's going to see you in a few minutes for your next visit. Other than that, just know your take-home message is that we will not let you leave. We will interrupt our regular flow of business because our sonographers have been doing this for many, many years. and they know what things should not walk out of the door without a plan. They'll come get one of us. We'll sit down with you and make a plan for next steps. Guess who else has a patient portal? Quest. It's very efficient and sometimes kind of annoying because they'll send the results to you before they send them to us. You open the results, you see all this red on there, and it freaks you out. But remember, red doesn't necessarily mean abnormal. The reference ranges that they're saying are normal are for people who are not pregnant. Pregnancy causes certain physiologic changes, and the reference ranges are different. So please give us a chance to receive the labs from Quest, review them, and release them to you with our commentary. I have had people who get their labs from Quest and they say, have you seen this? It's got all this red on it. And nope, I have not seen it yet, but just give me a moment. Let me attach it so you can see it. And then I don't need that. Just give me a little bit of time. Sometimes you will get them first. There's usually about a 48-hour lag between you getting the results and us getting them. Now, if you've had the results for a week and you haven't heard anything from us, then that means Quest maybe sent them to you and did not send them to us. So then please let us know so that we can contact Quest and get them directly. The reason that's important for us is because it closes a loop for us on getting on an order that we put in. We can say that we did receive the results so that we don't then begin to harass you the next time we see you. Why didn't you do your labs? So just let us know if you've had them for a week and you haven't heard anything from us. Any questions at all about using the portal, reaching us, appointment times, those sort of things? If not, we shall move on. All right. Prenatal visits. Again, pregnancy brain, it's real. You can't remember anything, can you? You walk into a room, you're like, what in the world? Why am I in here? I don't know. Same thing happens when you come to your prenatal visit. Something about walking through my front door brings on amnesia, and you forget all the questions that you were supposed to be asking at your next visit. So start a text thread with yourself, full circle thread, and text yourself questions. That way you come in, we won't distract you by the blood pressure and the heartbeat and all of those things. You'll still be able to say, okay, I did have questions. Wear loose, comfortable clothing so that we can access your belly. Most of my group on here is going to be pregnant through the chillier months, so I don't really have to worry about rompers. I think rompers are probably but overalls are a thing too. Please don't wear anything that you're going to have to pull over your head or, be sitting there half naked. Like, we'll give you a little gown that you can put on, but just a shirt that you can lift would be nice, or just pants that, you can just roll down around, because we want to get to that belly. We want to listen to that little baby. Please get here a minimum of 5 minutes before your scheduled appointment time. That will give you enough time to check in with the front desk, and be sure that you handle any insurance things with them, and it will not impinge upon your clinical time with your provider. We are not routinely checking urine samples. ACOG says we no longer have to do that. So if you need to leave a urine sample, you will know that. Front desk will have a tag as well on their chart that you need to leave it. Typically, it's only if we're following you for blood pressures, high blood sugars, or if you had a recent treatment for a urinary tract infection and you need to be tested to make sure that it's cured. So otherwise, we know you're pregnant and you have to go to the bathroom and you just drove here and you drank a lot of water. So when you come in, go on to the bathroom, it's fine. If you are 10 minutes late, that is our grace period. We will still have time to check on you and your baby. It leaves a little less time for your questions. If you are 20 minutes late, you have missed that entire appointment slot. And sometimes we do have some spaces in the same day. Front desk is actually really good about it. Sometimes there are accidents on, from the direction that you're coming from, and they say, man, she's not going to make it. But I see, there's a spot over here on this other schedule about 20 minutes later. And when you come in, they've already rescheduled you to that open spot. If that spot works out for you, awesome. If it doesn't, don't be mad at front desk. They were just trying to do you a favor. If it doesn't work out for you, we can try to work you in either a little later on in the day, or we can reschedule to a time that is mutually beneficial for both parties. All right, diagnostic ultrasound visit. So the question I get is, when do I have an ultrasound and how will I know? And when do I bring my family? Those are all excellent questions. I'm glad you asked. Diagnostic ultrasound appointments are separate from prenatal visits. So how do you know if you have one scheduled? Do you have more than one appointment time? And is there a provider's name associated with your visit? So when you log into the portal, this is Tina Test. She is our test patient. Tina goes in and she clicks on appointments. And when she opens up her appointments, she sees that on the same day, she has two appointment times. Her first appointment time is at 9:20, and it is with ultrasound. Ultrasound is not one of our providers' names. She has an appointment after that at 10 o'clock with Dr. Yeckel. Dr. Yeckel is one of our providers' names. So Tina can bring her family with her to the 9:20 appointment so that they can see the baby on the ultrasound. If they want, they can hang around and see Dr. Yeckel, who's also kind of cool, but they don't have to. If they just want to see baby's face, then that's fine. So this is how you will know if you have appointments scheduled for ultrasound coming up. Typically, we will do your anatomy ultrasound, and then if you have any issues, we'll do ultrasounds to follow that. Otherwise, not until after you go past your due date. The results of the ultrasound, remember, are sent to your portal within 2 business days. If you cannot wait 2 business days, be sure you're like Tina and you have two appointments on one day. If there's something urgently abnormal on your ultrasound, we won't let you leave without discussing those findings and making a plan for it. You notice I say the same things about this over and over. Please let the front desk know when you need a prenatal visit and a diagnostic ultrasound visit. So if you're coming out of an appointment and Jane says, hey, you need to get your ultrasound scheduled next time, don't leave without scheduling two appointments, a prenatal visit and an ultrasound. So help the front desk help you. We're sending messages to the front desk, but sometimes y'all are fast. Y'all get to that front desk before our message does. So let the front desk know I'm actually supposed to be scheduling two things, ultrasound and coming back from our regular prenatal care. All right. If we are not looking at your baby as many times as you want to look at your baby, there are boutique ultrasounds that you can do on your own. These are safe, they're fun. These are a couple of places for informational purposes. We're not endorsing anybody over the other, just put a couple in a few different places in town. Stork's View Babies Close Up and Sneak Peek. They do cute things like putting the baby's heartbeat in a little stuffed animal, and they give you all these 3D pictures. They're super cute. So just know that these places are out there. And if you want to look at your baby, when you want to look at your baby, these people will do it for you for a fee, of course. So check their websites. All right, poll question. When should you expect routine ultrasounds? Get that cute picture. At every visit, at 20 and 40 weeks, or only if you have a problem? The polls are open, and I am waiting for your answers right now because I just gave the answers to these questions. And the polls will be closing in 4, 3, 2, 1. All right. Polls are closed. At 20 and 40 weeks, that is correct. So the key word here was routine ultrasounds. So routine, we look at the anatomy around 20 weeks. If there's something that we don't see, we follow it up. If there's something abnormal that we're following, we'll follow that up as well. But those two things are not routine. As long as baby is measuring well and you don't develop any other concerns with pregnancy, like high blood pressure, high blood sugar, growth restriction, we won't look again until you go past your due date. We will listen to the baby's heartbeat at each visit with the Doppler, but not an ultrasound visit. All right. Okay, so we have switched over to our website. This is fullcirclejacks.com, and this is where the magic happens. We'll start with the providers. One of these lovely ladies will have the distinct pleasure of helping you welcome one of your little ones or your little one or ones into the world. There was me, that was Dr. Marrow, there's Dr. Yeckel, there's Dr. Mooney, we have midwife Lauren, midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. Our full-time midwives here are Missy, Jane, and Dawn, so they will be the ones that you'll be seeing the most of. Lauren is here one day a week, but she has the same delivery schedule as the other full-time midwives. So just as much of a chance as getting Lauren as any of the other ones, so please try to meet one of their 4 smiling faces whenever you can. If you're a scheduled cesarean delivery, you'll either be seeing my face, Dr. Marrow, or Dr. Mooney for your schedule, or Dr. Yeckel. Dr. Yeckel is also part-time. She does some weekends on the year, but not any in-office visits. All right. Over here under patient information, you'll see the obstetrics tab, and you'll know you're in the right place because you will see all these bellies that end with the baby. So lots of good info here. First tab is our delivery stats. So many of you are here because of our delivery stats. We have our stats here back to 2018, and can't believe we are going on getting our 2023 numbers should be coming out very soon. We are very transparent about our numbers. Some years are better than others, but we always tell you what our numbers are because we are very proud of them because we know that they are achieved using evidence-based medicine. So feel free to browse and celebrate with us. Prenatal care timeline. So here's what to expect at each visit. And as we open that up, I'm going to look at this question. The question is, are there more ultrasounds for women over 35? There is an offer for more non-stress tests for women over 35 toward the end of pregnancy, but not more ultrasounds specifically just for being over 35 unless you opt to be referred to a high-risk physician for that. All right, so this is our prenatal care timeline. Remember, this is available for you on our website. Everyone on this call has already had their prenatal care pregnancy confirmation visit, and that was your ultrasound and meeting with one of the midwives. You also met with Renee to go over insurance stuff, and then you were already scheduled to have a history visit with me. Your history visit is virtual, and we go over your medical history, figure out if there's any risk factors for the pregnancy, and make a plan for them. At that time, I will order your regular prenatal blood work. So if everything is very normal, these are the standard labs that we order. We have transparency and lab ordering. So, some people transfer to us and say, "Oh, I'm not really sure what they already checked." You will always know what blood work we are requesting on you because it's right here on the timeline. So, blood type, blood count, some serologies, and a urine culture are the standard labs. If you have some other pregnancy or medical issues, we may add some things in like thyroid, liver, kidney function, that sort of thing. Your homework is to try to get your blood work done before the next time we see you. Um, some of you opted in for genetic testing, again, because it is optional. And if you're doing that, you'll do these labs at a minimum of 10 weeks. And at this point in pregnancy, we're seeing you about every 4 weeks. So about 4 weeks after your initial visit, you're going to be back in the office for your physical exam. The physical exam is just like it sounds, routine physical, heart, lungs, abdomen, pelvis. If you are due for a pap test, you have the option of having your pap test done at that same time because it is involving the pelvic, but we don't really need a pap. So you can opt out of that. What we do need are cervical cultures, which complete the ACOG panel for prenatal labs. If you have a high risk issue and you need to be referred to a high risk doctor, the person who asked about being 35 and up, it's not required for us for you to see a high risk doctor if you're 35 plus, but if you request it, we're happy to make that referral. And again, as mentioned before, Naisha is the person who coordinates that for you as well. And then about 4 weeks later, you're coming back for just a belly check. We talk about some second trimester changes, good old round ligament pain, and quickening, starting to feel the baby move, which is a very cool day. Then around 20 weeks, as I discussed, we do our fetal anatomy ultrasound. You'll see on there a mental health screen as well. We do screen multiple times during pregnancy for anxiety and depression using the GAD-7 and EPDS as our tools. Because we have referral resources in the community that we want to get ahead of this because pregnancy can be a very emotional time and we want to make sure that we are treating the whole person, not just the uterus. So we do your anatomy ultrasound. If you meet with one of the midwives on the same day, we'll start talking about childbirth education and or breastfeeding classes. Then about 4 weeks later is when we get information on the glucose tests. I know there will be lots of questions about that, so we're putting a pin in that because I will return to that later on. We recheck blood work to make sure we're not developing iron deficiency or anemia because babies are adorable little iron stealers. My moms who have a certain blood type, we make sure that your medication for that blood type is in-house and prepared so that we can give it to you between 28 and 30 weeks. This is when we'll be giving you the information to register at the hospital. So everything is online now. There's a portal. I know you guys love portals. There's a portal at HCA Florida for which you register, put in all your information so that when you go to the hospital, you're not doing endless paperwork. This is about the time when you want to look at doing your hospital tour. And if you plan on working with a doula, she should be secured at this time as well. If you have questions about what a doula is, hang on because I'm going to address that in a moment. I'm going to answer these two questions before I move to the next one. You were booked for a health history appointment until January. Should I do blood work before then? I'm 11 weeks now. I think you're on a wait list to get moved up. So just double check with front desk and see what the progress is on that wait list. And the next question I have is, do we schedule the lab tests on our own, and where should we go for those? It sounds like you have not had your history visit yet. If you have had your history visit, I should have answered that. But if you haven't had it, I will go over it when I see you on the virtual visit. Um, so after that, after we do the glucose and ROGAM and all of that, we start seeing you every 2 weeks. You'll see in the middle here, option to repeat or decline standard prenatal labs. And you can see that this is an STD screen. So these are things from the Duval County Health Department. They are population specific. If you do not feel that you are part of a high risk population for contracting any of these STDs during pregnancy, we have a very simple form that you can just say, I'm opting out of repeating these forms, these labs rather, and that's that. First time mamas, you want to make sure you are interviewing to see who your pediatrician can be. We have quite a few brochures around the office, so you just want to look for someone who matches your philosophy and is not super far away from you, because when you have a sick kid, you don't want to be driving across town in traffic. Flu and Tdap, if you haven't already gotten them, we'll remind you of them. They're not offered here in our office. It's just a reminder, vaccines are not required by us. But for those who want to get them, we can help you figure out where to get them. The appointments are every 2 weeks, and my moms who have any issues with high blood pressure or diabetes, we start fetal testing. For those who are planning a scheduled belly birth, which is our term for the C-section, around 33 weeks is when we're going to start to get the books open so that we can get you on the schedule for that. We will usually do those around 39 weeks unless you have some other circumstances with your pregnancy, like previous fibroid removal, and it needs to be at 37 or 38 weeks. Then we continue with the every 2 week visits. We see you around 36 weeks where we do your group beta strep screen, which is not an STD, but normal flora. And we'll talk to you about why that is important at that time. And if you've already opted out of repeating your STD screening, then you've opted out of repeating your cervical cultures as well for gonorrhea and chlamydia. After this visit, we start seeing you weekly. It gets real. You're going to bring your birth plan in for discussion after this visit, because at 37 weeks, you are full term, and we want to hear what your birth plan looks like. Before 37 weeks, you're preterm and your baby made a birth plan. And so we're going to listen to what your baby's plan is. But we start our natural cervical ripening methods. And then my mamas who are planning for a belly birth will get off the train here uniformly, if not earlier. And then those who are waiting for baby to give the signal will do the hardest part. You will be patient and wait for that. Especially my first time mamas, don't get impatient and say, I just want this baby out, because we like for you to be delivered by 42 weeks. So you have a little bit of time past your due date to let little one snuggle, but everyone needs to be out by 42 weeks. So first time mamas, 41 weeks and 5 days is typically when we want to schedule. And for my veteran mamas, 41 weeks and 6 days, because your labors are usually shorter than my first time moms. So remember, this entire what to expect is on our website, and you can feel free to print that out or download it to your phone. Very good. Okay, next poll question I have is, if you have a headache during pregnancy, are you more likely to meditate? Like do some meditation, do some yoga, that's some deep breathing. Medicate, take a Tylenol or something along those lines, maybe Benadryl. Or evacuate, leave your house and go to the emergency room. Hopefully nobody's having headaches that are bad enough to send them to the ER. Polls are closing in 3, 2, 1, that's it. All right, we have more meditators than medicators today. Not surprised, and zero judgment on either way. It depends on the day. Some of you I've already talked to, and you said, oh, I've been suffering with this, but I know I can't take anything because I'm pregnant. False. Click on this. Pregnancy safe medications. So this is a list of common pregnancy discomforts. They're in alphabetical order, and relief measures in the middle. So the relief measures, you can see some of them are not like well, they're not medicine, but these will be the things. If you send us messages saying, oh, I'm struggling with constipation, because nobody tells you about how sexy constipation and pregnancy is. But if you're struggling with this, the first things we're going to tell you are the things that are on this list. Those are the relief measures. And then if those things are not working, then the medications that are okay for you to go and pick up are over here on the right-hand side. And even some of the things on the right-hand side are not Western medicine. You'll see some more holistic things like aloe tablets, diffusing peppermint oil. You'll also see some things that we want you to avoid, like pseudoephedrine, because that can elevate your blood pressure during pregnancy. No Pepto-Bismol, no Lomotil. Mucinex, wait until after 16 weeks. So you can just see this list again. And then another caveat here for nausea, vomiting. If you can't keep anything down, including fluids for 24 hours, please call us. Don't keep trying the things on this list because they haven't worked. You need a prescription for something. If you have exhausted everything on this list and you are still having the problem, then definitely reach out to us. And I can always tell who did the webinar because you reach out and you say, hey, Dr. Adams, I've tried everything on the list and this did not work. So what else can I do? Because the first thing I usually write back is a link to this list if you write me with anything that's on this list. So again, if you are old school, print this out and stick it on the fridge. If not, you can just download it to your phone because every time you need it, it will be like 3 o'clock in the morning, I promise. All right, headed back to the website, and you guys may already be seeing that because again, I have a lag. Gestational diabetes screening test. We won't click on this one today, but please remember that this is there because I'm going to reference it a little later in the webinar. Weight gain in pregnancy. All right, some of you have expressed concern because you have not gained any weight yet in your first trimester. And some of you have expressed concern because you have gained a lot of weight in your first trimester. So your recommended pregnancy weight gain overall is based on your pre-pregnancy body mass index. So here's a link to the NIH Gov site where you can put in your pre-pregnancy height and weight. It will tell you where you're classified and then how much weight is recommended for you to gain in pregnancy. You'll see on that last column there that the rates of weight gain are in your second and third trimester per week. So if you have not gained weight already, don't worry about it. The baby kind of hazes you in the first trimester. Nothing tastes good, nothing smells good, you're nauseous. Like, of course, you're not gaining weight. That's okay. We measure your weight gain in the second and the third trimester when your blood volume increases, and especially that third trimester when baby starts to get chunky. Love a good chunky baby. Okay, so this information is out there as well. And we'll go back. And birth preferences. Yes, let's definitely click on that one. So remember when I said after your 36-week visit, you're going to bring in your birth plan. Hey, here you go. Here's a template for your birth plan. So this covers a lot of different things. Sometimes getting some of your thoughts out online can just kind of help with anxiety for a process that you're not just familiar with at all. So everything from how you want labor to start, what you want to wear in labor. If hospital gowns freak you out, don't wear hospital gowns, girl. Go ahead and on Etsy and get yourself something with the baby's name embroidered on it. Just know it's going to be a mess. You'll probably never be able to wear it again, but that's fine. Just don't wear the hospital gown. We have multiple options for monitoring the baby. We can do continuous. We have enough wireless monitors for each hospital room. We can do intermittent based on your clinical scenario. For pain relief, there we have, obviously it's a hospital, we have epidurals, we have IV pain medicine, but we also have hydrotherapy. So we have tubs to make labor more comfortable. They're warm tubs. Oh my gosh, they are amazing. And they're disposable. You can take them home with you afterward. And then nitrous as well, just like at the dentist's office. The main thing I want you to see here is that we're not starving you. We're not strapping you to the bed. We encourage different positions for labor. We encourage different positions for pushing and for delivery. Our standard is delayed cord clamping and immediate skin to skin, early latch. So the nurses will help you with latch early on. If you need help from a lactation consultant, they also round automatically. You don't have to request it. They will come around and help you with any issues with feeding. If you're having twins, we'll talk more offline about that, but twins add an extra something spicy to it as well. But you do have some options in twin delivery too. On here as well are the standard medications offered to newborns, and your prenatal visits are an opportunity to talk to the midwives. Hey, what is this for? Does this apply to me? What are the risks of taking it? What are the risks of not taking it? And make some, good clinical decisions with her. For my moms who are anticipating a belly birth, the last column down here, or the last box down here rather, is for you because Full Circle does gentle cesareans, and it is a term that Dr. Marrow and I coined, and Dr. Mooney has joined in wholeheartedly. And for these, it is still a family-centered delivery, and our move to HCA has not slowed that down at all. And so that's you don't have to request a gentle cesarean. That is our standard. Question I have is there ever a reason to break the water? Sure, there are lots of them, but it's not a standard thing. So if that is a question for something that's happening during your labor, then that's something that you discuss with the midwife about you specifically. All right. So again, birth preferences. You can start working on this. You can start working on it at any time and then bring it in when you're full term so we can set expectations. Cervical ripening techniques. So again, at some point, you're going to want this baby to get out. And you will come in asking us, how can I make him leave? How can I make her get out? So these are the things that we will direct you to do. These are evidence-based. So 20 weeks, you can see, and the level of evidence is different for each one, but you can see week by week what we really recommend. So 36 weeks is when it really starts to ramp up. The one thing that you will not see on here is castor oil. And you can ask any of the midwives in your appointment why we do not recommend castor oil to start your labor. Great. Next, first time moms. First time moms, listen up. And also, do I have any moms in here with a prior cesarean? Like anybody planning for vaginal birth after cesarean? And there are only two options for this. Either it doesn't apply to you, or yes, and you're going to rock it. Okay, all right. So some of my veteran mamas are trial of labor after cesarean. Awesome. Fantastic. All right, polls close in 3, 2, 1. Okay, very good. So, really, a lot of people on this call should be listening to this then, because either you're a VBAC mama or you are a first-time mom. And really, my advice for you is exactly the same because you are both trying to avoid unnecessary C-sections. So many of you know Dr. Marrow and I are VBAC mamas. So our first babies were born by cesarean, and so we definitely have a passion for helping mamas join the club. So these are some things that we did in our pregnancies to try to ensure that we had our best chances. You know, babies are going to baby. They're going to do whatever they're going to do, but we can control what we can. So these are ways to reduce conversion to cesarean. I just recently had a conversation with somebody too about all these people working from home recently. When you're sitting at home and you're slouched back like this, it encourages babies to be sunny side up or malpositioned. And that is the most common reason that we are doing C-sections these days on our first time mamas. It is not because the baby is too big. It is not because the baby is in distress. It is because the baby is in a funky position and we can't get that head to turn right to come on through. So take a look at all of these things. I'm going to go into some of them in a little bit more detail later on. But if you do everything on this list, then you've done everything that you can to ensure that you put yourself in the best position to avoid a C-section if you're trying to avoid it. All right. And I see my host is highlighting trust your body and your providers. We want what you want. We're not fighting against you. If we recommend something, it's because we're trying to get the outcome that you want to in the safest way possible. All right. Circumcision care. If you have a little guy and you want to have him circumcised, we do that in the office, not at the hospital, because he needs a little bit of time, some days to figure out how to be a baby before we start doing stuff. So we do those in the office up to 10 days of age. Just let us know when you deliver. We'll reach out to our OB coordinator and Naisha will send you a portal message with his first little appointment. So sweet. All right, so all the stuff is out here. Just remember that as we go back to the presentation, I am going here. And the question is a personal one that I think should be asked at at one of the visits. And we can discuss that one a little bit more offline. Okay. All right. So first thing we see here is that we are attacking Dr. Adams today. What is that about? Um, because when I say I can't get this last 5 pounds off, I'm drinking coffee every morning. Are you Dr. Adams, or are you drinking a salted caramel mocha monstrosity with 570 calories and oh my gosh, the fat? It's the holidays. It is. Did you know that pregnancy only requires 300 additional calories per day? Oh my goodness. Okay. It takes 10 kilocalories to maintain 1 pound, and the recommended amount of weight to gain is based on your starting body mass index. So let's say we start the pregnancy at 170 pounds. That takes 1,700 calories per day to maintain. If you're supposed to gain 25 pounds based on your BMI, that's 250 additional calories for a total daily caloric intake of 1950. Divide that between breakfast, lunch, and dinner, and that is 650 calories per meal. Now, if you eat your 650 calories, Dr. Adams, and then wash it down with a mocha monstrosity, guess what? All those extra calories do not go to baby. They don't. They go to you, and you get to keep them. Happy Mother's Day. All right. What things should you be eating? So protein, vegetables, fruits, all the things. Flip them over and take a look at them. Y'all, confession time. I ate all the sugar yesterday, like all the sugar. It was at my house, and I went into the refrigerator and I ate it. And afterward, and then I drank it. And then I flipped over the things, and I was absolutely horrified that one ginger ale, which I almost never drink, one ginger ale had 71% of the sugars that I was supposed to have for the whole day. Sugar is so sneaky, and it's a quick way to put on sneaky, sneaky pounds. So remember again, this is on our website, so you can refer back to this with regard to what percentage of your caloric intake should come from what groups every day. And then just looking at the sodium, simple choices here, like both of these are spaghetti sauces, but one of them has nearly 500 milligrams less of sodium. That's a big deal when you're trying not to be very swollen as you deliver in the summer. I'm talking to my summer pregnant mamas. I never wanted to be pregnant in Florida in the summer. So good luck. Do not eat all the sodium. Eat some fruit, some veggies, some whole grains, some cereal. You're not going to give your baby an allergy to nuts or dairy if you eat those, so go ahead and enjoy. Caffeine for my coffee drinkers, you want to keep it under 200 milligrams daily. Now, having said that, do remember that caffeine is a diuretic, so use the 3-to-1 rule. You want to take in 3 times as much water as caffeinated beverage if you're going to continue to drink coffee. Also, if we start to hear irregular heartbeats in baby at the end, we may say to cut out caffeine altogether. So just know that may be a thing. Herbal teas are fine, and these are our favorite for pregnancy: raspberry leaf, ginger, lemon, and peppermint. For my weightlifters, my bodybuilders, protein, and even for those who are having trouble, keeping down regular meals right now and are boosting with protein shakes. 70 grams is still your sweet spot. So 70 grams of protein total. I know there are some pregnancy diets out there that say that you need to cram in 120 grams of protein per day. First of all, that's very difficult to do. That's a lot of protein. And secondly, it's just not necessary. Like, this will maintain a healthy you and healthy baby. My mamas who do these 120 grams always wonder, why are you following me for a big baby? Because your baby's 10 pounds, because you've been giving him brontosaurus burgers every single day. So 70 grams of protein is plenty for everybody. Deli meats. Somebody asked me about Publix subs. Aren't they awesome? Yes, you can. You can have deli meats as long as you microwave them for 30 seconds. You do not have to have it piping hot, fresh out of the microwave. Don't burn your mouth, but just be sure we've had enough exposure to heat that we kill the harmful bacteria. For soft cheeses, if they are made with pasteurized milk, they are fine. So if we're buying from Trader Joe's or Publix, just flip it over, and if we see pasteurized milk, we're good. If not, then like you're at a restaurant, you can't tell whether it was pasteurized or not. Then this just skip the cheese for that day. Canned tuna, you may have 3 4-ounce cans of that per week. I think that's enough tuna, but if you need more than that, then here's the document for you. If you're a pescatarian and you're eating fish and you need to know how much fish you can have, the FDA has a whole document, 2 pages of what fish you should eat in large amounts because it has DHA to help with baby's brain development, what fish you should eat in moderation, like tuna, because it may or may not have methylmercury issues, and which ones you should avoid or eat sparingly because of definite known methylmercury. It's a long document, not going to commit it to memory. So just know that this document is out here for you. Enjoy your fish. All right. Things you should not eat though: undercooked fish. So for my sushi lovers, my ahi tuna lovers, I'm so sorry you can't have those for the next couple of months. My steak lovers, if If it's anything other than ruined, which is my word for well done, then it'll have to wait until after pregnancy as well. Kombucha drinkers, kimchi eaters, those are fermented beverage and food. Those will wait as well because your body treats fermented things as alcohol. Also, no alcohol, even alcohol-free wine, because I don't know why, but alcohol-free wine does have alcohol in it, but maybe they don't charge you for it. So it's alcohol for free. Also, keep your total daily sodium under 1,500 milligrams. Again, turn your food over and be appalled with me about how much sodium is in everything. Because when you send me that portal message saying, my rings don't fit anymore, Dr. Adams, I'm going to say, how much sodium did you have last night? And then usually people close the case after that because they're so too embarrassed to admit to me that they just ate, they made it an Arby's night. All right. Any questions about diet and nutrition before we move on to exercise? Okay, cool. Okay. Oh, there is a question. All right, we're moving on to exercise too. Are sauerkraut and apple cider vinegar okay? ACV is fine, but sauerkraut we want to hold off on. That's a great question. I'm going to add sauerkraut to my thing with kimchi. Um, it is okay for you to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. Um, Did you hear judgment in my voice when I said that? Oh, okay. Although you will not feel like doing very much in the beginning, in the second trimester, that's your time. Physiologic changes, you're going to increase your blood volume by 50%, and that will increase your oxygen tensions and saturations. You'll be able to do more aerobic activity. So give yourself some grace. If you are not the Olympian athlete that you were before pregnancy, you will get back to that level because you'll accommodate more activity. So just listen to your body, take it slowly, and build back up to what you were doing before. Now, if what you were doing before was nothing, then stop that. It is okay to begin a new regimen. It doesn't have to be anything crazy, but please remember, and I'm repeating this because it bears repeating, sedentary lifestyles lead to malposition babies. Malposition babies lead to cesareans that I really don't want to do. If you guys have one of these little Fitbit watches too that give you your heartbeat and your heart rate at every minute of the day and raise your anxiety, just know that resting heart rate will go up by 10 to 20 beats per minute physiologically. That is a normal body change. It is okay. As long as you're not getting dizzy and passing out with that, it's fine. For those of you who have been saying, well, I do exercise, I walk. And I said, oh, we'll talk about that. We're going to talk about it right now. So if when you walk, your heart rate is in the aerobic zone, which is 70% of your maximum heart rate, then that is exercise. Your maximum heart rate is 220 minus your age. So if you are 30 years old, we start with 220 and we subtract 30. So your max heart rate is 190. You should not be exercising for extended periods of time with a heart rate over 190. 70% of that is 133. So if when you walk, your heart rate is between 133 and 190 for 30 minutes, 3 times a week, then walking is exercise. If when you're walking, your heart rate is still in the 80s or the 90s, then walking is transportation. And while it's important to get where you're going, it does not count as exercise. So please find some way to do aerobic exercise. The next hang on a second. Oh, question here then. For Orange Theory, should I avoid the orange zone? So I've never been to Orange Theory, but I would like orange doesn't sound like a good number for you to see on stuff. Like if your orange zone is more than 220 minus your age, then yellow zone is for you. Yellow zone is a thing. Um, think the next question here is what resting heart rate is too high? It only depends if you are symptomatic. So, I mean, typically, if your resting heart rate is above 100, 105, that means that you were probably at like 80 or something prior to pregnancy. If you're in the 120s, the one teens or 120s, let us know because we may just do a cardiology referral to be sure that it's just a physiologic change for you. It's a good question. No one's asked me that before. So what types of exercises can you do? Because this looks like this may be the exercise crowd. Y'all haven't asked very many things. What are your opinions on CrossFit? I'm actually getting ready to give you those questions. It's like you're a mind reader. So cardio. Treadmill is fine. Elliptical is okay. Running is great. Swimming, find yourself a heated pool because y'all are my December crew. Indoor bike, if you have a Peloton. My leaderboard name is Off My Meds 8. If you follow me, I do follow back. I've been doing great putting numbers on the board recently, so let's inspire each other. All right, other things that it's okay to do. Weightlifting up to your pre-pregnancy level is just fine. You don't need to increase your resistance during pregnancy because your baby and your body are going to be doing that. Squats are my favorite. Please build up to 50 squats per day. If you're already doing at least 50 squats per day, you can do more. If you're not an experienced squatter, then you want to start at 20 weeks with 5 squats a day. 21 weeks, give me 10 squats a day. 22 weeks, give me 15. And you're building all the way up, and they don't have to be all at one time. You can give me 25 in the morning when you hit the floor and 25 right before you go to bed. Rowing is fine for cardio. Also, that's a question that I have out there too. Pilates and yoga, though, are my absolute favorites. So you want to think anything that makes those muscles long and lean. Those are things that open up the pelvis. My CrossFit mamas, this is part of my speech. My CrossFit mamas, your muscles are so tight. Like you're in amazing shape and you snap back great. But during delivery, like your body is fighting with the baby to let the baby out. Like the baby wants out, but your body is like, no, my muscles will not let you out. So CrossFit is okay. Like do the low intensity version of it. Like our next slide is going to show us things that you want to stay away from or try to limit. And the first one there is high intensity intervals after first trimester, which a lot of that is CrossFit is a lot of that. So it's not the intervals, it's the intensity. So the low impact version of those things are okay. Again, also long, lean stretching. That's what you're looking for, not building thick, tight muscles. Anything that has you lying flat on your back for extended periods of time, like ab work, you can do side lying abs, you can do standing abs, but not lying flat on your back, like for a whole ab class. Hot yoga, unless you're a hot yoga instructor and are fully acclimated to that environment. Otherwise, you will definitely get dizzy and fall. Scuba, because of the changes in barometric pressure, high altitude hiking for the same reason. If you're visiting family in Colorado, that's fine. Just don't go hiking with them. Contact sports, please do not take up kickboxing during pregnancy. And outdoor biking after 16 weeks has an asterisk. It's not a no-no. It's just you're at 16 weeks, your center of gravity changes, and when you try to make those curves, you will sometimes just fall over off the bike. So you can avoid that by just being mindful of that. All right, questions about exercise? It's time for a poll question. I knew y'all were the exercise ones. So now that we talked about diet and exercise, can you prevent gestational diabetes with proper diet and exercise? All right. I know my veteran mamas definitely know my soapbox about this. Polls close in 3, 2, 1, done. All right. The answer is no. You cannot prevent gestational diabetes with diet and exercise. Why? Because that's judgy. Gestational diabetes is not a diagnosis of judgment of lifestyle. You know how sometimes you don't feel right and you're like, man, it must be my hormones. Guess what? Gestational diabetes is based on hormones. Everyone is screened for gestational diabetes because you all have the same one risk factor, and it is a placenta. Your placenta gives off hormones, and one of those hormones tells your insulin, you don't have to do your job today, man. You can call in sick. Terrible, terrible influences. But your insulin's job is to clear your body of excess glucose. So if your insulin's not doing its job, you're going to have extra glucose in your bloodstream, which is diabetes. And it only happens with the placenta. So it is gestational diabetes. So people say, but no one in my family is diabetic and I eat very well and I don't have a high BMI and all of these things doesn't matter. Your placenta is telling your insulin to take a break. And so you have gestational diabetes. So if you can figure out how to do this pregnancy without a placenta, I will not screen you for gestational diabetes, but you can't. So for my moms who say, but I never eat any sugar, don't avoid carbohydrates prior to the test. Eat your fruits, eat your whole grains, your healthy, normal carbohydrates that you need for energy. Like carbohydrates are not bad altogether, just not the way I ate them yesterday. Don't ever do that. If the drink itself is what bothers you, the Simply Pure drink we have available for sale here. It is soy-free, it is dye-free, it is gluten-free, it is BVO-free, it is kosher, it is vegan, it is offensive to almost no one. If it is still offensive to you, though, there are additional options. Remember that box we did not click on the website, the gestational diabetes screen. There are patient-driven options, including the fresh test and glucoorganics, as well as glucose tabs. So go back to the website and you'll see those things on there too. Preparing for birth, childbirth education classes. We talked about the ones HCA offers. There are also classes in the community. So those of you who are looking for unmedicated deliveries, there are several methods: hypnobirthing, hypnobabies, Lamaze, Bradley method. These are for informational purposes only. Again, the midwives will be great resources on telling you which class and which instructors are out there too. The question I have is gestational diabetes testing done at Quest? Yes, it is. And if you're planning to use any of those other alternative methods, please let us know so that we can put it on your lab slip, because Quest is also not accepting outside drinks. We'll send you to a different lab for that, and we'll put it on the lab slip so that they know to give you the instructions for that too. Breastfeeding classes, again, the hospital has them, and we can also connect you with La Leche League, as well as IBCLC, certified lactation consultants in the community. Every new parent should know CPR. Here are a couple of links. The Red Cross, as always, is out there. And then Jax Mobile is a group that will come to you and actually do the class in your home, which is super cool. If you're seeing a chiropractor, which was on our list for avoiding an unnecessary cesarean, be sure he or she is Webster certified, which is a special pregnancy certification. They know how to adjust you for the changes that your body makes during pregnancy. All right. The next question is, who here is planning to work with a doula? The polls will close soon, so please answer. All right. I see some people already know that they're going to be working with the doula. Hopefully, those are my VBAC mamas, and some people just aren't sure. All right, excellent. Moving on, because the question a lot of people, what is a doula? Ooh, this seems like a lot of a big team that I need for all of this. Well, yes, it is. We have a whole team dedicated. What are doulas there for? Doulas are there for emotional and physical support. First time moms, I highly recommend a doula for anybody who has anxiety, first time mom or not. If you have anxiety, you need a doula. Because doulas are safari guides for this safari we call pregnancy. We give you a lot of resources, but ultimately we're here for medical care. Doulas are there to support you emotionally. They're there to support you and advocate for you in the hospital. The midwives here, we work with a lot of doulas. We love doulas. We are doula friendly. The midwives here know which doulas have been giving our mamas the best support and can definitely help you with recommendations if you're looking for somebody. Acupuncture and pregnancy massage. When you come out of the bathroom in the front of the office, you will see cards. Everybody up there we know provides these services for pregnant people. So be sure that you avail yourself of their resources to alleviate some of the discomforts with a human sitting on your bladder and spine. All right. Breast pumps, most of your insurances will cover breast pumps. We have a company that there's no kickbacks for us except for the fact that they don't ask us a million ridiculous questions. They just get the prescription, have us sign it. They contact your insurance company. They reach out to you and tell you these are the ones your insurance company will cover. You pick your pump and off you go. These other companies, sometimes y'all want to do your own research and find these companies that want to know, what size shoe you wore in the fourth grade and all these other ridiculous questions that we just don't have time to research. We have QR codes in every room. Scan them and get your breast pump. And that is all, because we want what you want, for you to get your breast pump and us to have to do as little as possible for you to get your breast pump. Please and thank you. All right. We also have postpartum care. So for my mamas who have any blood pressure issues during pregnancy, we'll see you back sooner than the usual 6 weeks to make sure your blood pressure is okay, because preeclampsia sometimes happens postpartum. I know, mind blowing. For my belly birth mamas, we'll see you back for your incision check, routine mental health screen, again, for anxiety and depression. Postpartum doulas are a thing, and we might recommend that for you too, because again, remember, emotional and physical support, when do you need that more than right after you have a baby? The Motherhood Space is an amazing new resource in Jacksonville, and you will see a post from us very soon, because I had the opportunity to hang out with the founder and the director of the grant, Dr. Jill Garrett. It's it's a fantastic resource, kind of a play date for mamas who need a break for brand new moms. So that is something that you'll be hearing a lot more about from us in the coming future. And then pelvic floor therapy, put it back where we found it. So babies change things, y'all. Physically and emotionally. So this is standard of care in Europe is to have pelvic floor therapy to get to kind of turn back some of that discomfort that comes with having a human sit on your pelvic floor for 8 to 10 months. It has nothing to do with whether or not you push a baby out. Even for my belly birth mamas, just having that baby in that position can weaken your pelvic floor. And our goal is to help you strengthen that so it doesn't cause problems later on in life, like urinary incontinence and prolapse. Random frequently asked questions. You can sleep on your left side, your right side, your back. Yes, you can sleep on your back. If that freaks you out and you want to sleep on a side or you're waking up dizzy and you think it has something to do with sleeping on your back, get one of those wedge pillows off of Amazon, stick it under one of your hips, and you'll be fine. You can paint the nursery. Just be sure you're in a well-ventilated space and wearing your mask. You can take probiotics in pregnancy. You can also dye your hair, which includes your eyebrows, which was a question that I did get before. You can put, you guys can probably already see the next one. You can do gel nails. If you're going to a salon with heavy fumes, you may want to consider masking during that as well. Holidays are coming. You may travel in a car. Most of you on here are not 37 weeks, but just be sure you're getting out to stretch every 2 hours. And if you are drinking enough water, you will be doing that. Skincare, you can use your salicylic acid, your benzoyl peroxide, just nothing that has retinol in it. There is a retinol alternative called bakuchiol, which is a natural derivative. It's Bakuchiol. And so that is fine in place of retinol. And flying is fine for my twin mamas up to 32 weeks, for my singleton mamas up to 36 weeks. Just be sure you are wearing compression hose, doing toe raises in the seats, and staying very well hydrated in order to prevent blood clots. Things to avoid: roller coasters and water slides. I think most of y'all are delivering right about the time that those things will be coming back. So don't do them because you'll also be huge at that point. So you won't even want to. All right, quick COVID-19 update and then we'll be done. I promise. Thank you so much for hanging in there. So vaccinations, ACOG moved from supporting either way to strongly recommending them based on a New England Journal of Medicine article testing 35,000 women who were from preconception through postpartum. Moderna and Pfizer are okay. Johnson & Johnson is not recommended because of the risk of blood clots. If you need to get a booster, all vaccines are approved for booster. Around third trimester is good if you're trying to confer passive immunity through breastfeeding to your baby. 6 months past your your second Moderna or Pfizer are fine, or 2 months past your Johnson & Johnson. We don't recommend another Johnson & Johnson, so mixing and matching is okay. You don't have to time these optimally against Tdap or flu because they all work differently. If you contract COVID, so I'm going to slow down at this point because COVID is back. I have 2 staff out right now because some amazing person came and gave the gift that kept on giving. Please don't come in here. Please don't come in here with COVID. Y'all, we had this last year. Everybody was out. I was literally answering the phones in the front, which I can do, but I think you would much rather me be performing in the capacity as your physician. Thank you. So also there are no formal recommendations for ivermectin, azithromycin, or Plaquenil. If you think that it is just a sinus infection, it's not. It's COVID or the flu. And so please go get tested before you come in here. I cannot stress enough. Please do not come in here and give my staff COVID. All right. Things that we do recommend that you take are the vitamin D3, zinc, vitamin C, and low dose aspirin, 81 milligrams daily until you're 36 weeks. If you contract COVID after 36 weeks, don't start the aspirin then because of increased bleeding risk. Also, from the time of diagnosis, we will do serial growth ultrasounds to ensure that we're not getting growth restriction from how COVID has been shown to affect placentas. If you do contract COVID, again, recommended course of action is supportive treatment at home, not at my office. Please see the website for sore throat, congestion, all the cold meds. You only need to go to the hospital if you're having difficulty breathing or if you have a fever that is greater than 101 that's not coming down with the recommended amount of Tylenol. You don't need to get a pulse oximeter. Just if you can't breathe, go to the hospital. Please don't sit at home waiting on Amazon Prime to tell you that you can't breathe. We are back up to our pre-COVID numbers for visitation in the hospital. 4 visitors plus your doula, who's not considered to be a visitor. She is part of your birth team. Masking in the room and labor only if you actually have COVID when you are delivering. And then if you do have COVID at delivery, we still do not separate you from your baby. You're given an isolate so baby can stay in the room and be protected from your respiratory droplets and not contract it. All right. Last question. What can you find on my website? Can you find information for creating your birth plan, for safe medications in pregnancy, for what to expect at each visit, or everything? Yes. And the polls will close in 3, 2, 1. Any questions that I missed? Thank you guys for waiting to the end because a lot of your questions, I was like, oh, I'm going to get that in just a few slides. So that is all I have. So do you have more questions now? If so, I'm happy to take them. If not, that means I did my job. All right. Thank you guys so much for rocking with me. Please remember we are social, so follow us on all the things. We're on Facebook, we are on Instagram, we are on X, formerly known as Twitter, and we are on YouTube, which is where you will be able to see this playback in just a couple of days. I appreciate you all. Believe me, I know you can throw a rock and hit an obstetrician in this town. So I do appreciate you choosing Full Circle, and we can't wait to help you grow your family. Question I have here saying asymptomatic COVID still affect placental growth? Yes. If you have a positive test, it can still affect growth of the placenta, which is why we just make sure that it's not affecting baby's growth with the ultrasounds. All right, excellent questions. You guys have a great evening and we'll see you in the office real soon. If I do not see you personally, happy holidays. Bye.